Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. Now, with less than 40,000 fresh COVID cases recorded in 24 hours, India registered the lowest daily rise since March 19th amid easing of curbs in several parts after tough restrictions due to the second wave of COVID. 723 deaths were recorded since Sunday. And if we take a look at the vaccinations, 35.28 crore vaccine doses have been administered so far under the nationwide vaccination drive. But the daily vaccinations are slowing down, which is a matter of great concern. On Sunday, 14.81 lakh vaccine doses were administered. Now on the show, a very interesting technology which is being used in Abu Dhabi to detect COVID infections, but there has been some amount of skepticism around it. Abu Dhabi is using what's called EDE scanners to detect COVID virus infections at malls and airports after a trial of 20,000 people showed a high degree of effectiveness. That's what the reports say. The EDE scanner was developed by the EDE Research Institute Abu Dhabi, and it measures electromagnetic waves which are reportedly altered when the RNA particles of COVID virus are present. Well, to explain this to us better and talk more about it, we're joined by Dr. Mohammed Rafiq, Medical Director, Pulmonologist and Chair of Infection Control, Prime Hospital, Dubai. Thank you so much for joining us on the show, Doctor, and explain this technology to us. It's very fascinating and very helpful as well.
Yeah. Hello, good afternoon. Actually, this has been how technology comes to help us in the field of medicine. And there's a lot of science going behind this, a lot of research. And the very new initiative rolled out by the Department of Health, where they try to look into electromagnetic variations in a person who gets infected with, or the virus is there in the body of the person. And this is mainly used for mass screening, especially in shopping malls, in entry points, and probably into airports, because where you get the result in a quick period of about 5 seconds. And there is a diameter or radius of about 5 meters. So there's no need to go close to the concerned individual. So you keep a safe distance. And within a 5-meter radius, the changes in the electromagnetic waves just show up as you see in the video. And it is basically by a research institute who has come out with this concept. And they are using facial scanners, which can also be by a mobile app. Probably technology will throw more light on that. So the idea behind this, it gives you an additional layer of safety. And if there's any person who is suspected to have signs of
Right.
COVID, then for sure you need to go do a PCR and then confirm if there is the case. And they did find that it's close to 93.5% sensitive in picking up, people who have, infection.
Right. So it's just a few days since it's being used, but there's been a certain amount of skepticism around it. Have you got inquiries from other countries? I know this is something that could be very, very useful, but many have questioned how, the electromagnetic waves are affected like this, and whether COVID could be detected in this manner. And when it's detected, the person is asked to go and get a RT-PCR test?
Yeah, see, traditionally, if you see, before we were using infrared thermometers, and thermal scanners in the shopping malls, and I think that has been the practice all around before. So that works on the temperature of, temperature variations where you get picked up any febrile people. But this has been a different technology, and they have done a large trial in about 20,000 patients, and they found it to be very effective. And I'm sure this could be the way forward, where people would start. I'm sure more countries will start looking into this, and ionizing radiation, electromagnetic radiation. There's a lot of things to science can bring in, and I'm sure artificial intelligence will help us go through these pandemics.
No, absolutely, yeah. And we need more such technology, because clearly we have to live with coronavirus in a sense while vaccinations are continuing. The infections will remain in the population, and we just need to manage and detect it. So this would be very useful. If you could tell us, will some reports come out? And again, other countries, it would be useful here in India, for example.
Yeah, I think it has just been about a week since we started. And I think next will be the airport exit points. So probably we'll get more information in the coming days. But as of now, it has been doing a great job. And people who are found to be turning not positive, not the green, then they do go for testing. So that is something which we can look into and see how much, they say about 83% of people who are not infected also it can be picking up. So there's a lot of, we'll look forward for more information to come. But I'm sure even countries like Israel, they are also, I found that they are also looking into research on tetra waves and hertz. There's a lot of technology there. I think an IT person would be better to comment on this.
Right.
But from a medical background, whatever helps us to get through this pandemic especially in large populations and all this, it is a welcome point actually.
All right. Thank you so much, Dr. Rafiq, for speaking to us here at NDTV. And we'll look forward to hearing more about these scanners and hopefully use them more extensively. They can be used more extensively around the world. Thank you so much. Now, in the second wave of COVID that hit Delhi, 5 cases of cytomegalovirus or CVM-related rectal bleeding were reported in 5 patients with coronavirus in the Sir Gangaram Hospital. Now, patients with cytomegalovirus have complained of bleeding in stools and of abdominal pain. One patient even died while others are being treated. Well, to talk more about this infection that has emerged in the second wave, we're joined by Dr. Anil Arora, Chairman, Institute of Liver, Gastroenterology, Sir Gangaram Hospital. Thank you so much, Dr. Arora, for joining us. If you could tell us about these cases that are emerging, and this has emerged for the first time in the second wave.
Yeah, you see, cytomegalovirus infection is a common commensal in the body. If we test it in the blood, 80 to 90% will have it as a dormant infection. It lives in a complete harmony in a patient's body. So whenever for different reasons, either because of the virus itself or because of the therapy which is given to take care of the virus, if there is a plummeting of the immune system and immune system is suppressed, then virus tends to show its ugly head, tends to get reactivated and affects the various parts of the body. In our patients, this unfortunately had affected the intestines, leading to ulceration in the large and small intestine, presenting with gastrointestinal bleeding. Of the 5 patients we have had, one had a massive bleeding. He also had a concomitant chest infection and died. One patient required around 18 units of blood transfusion requiring surgery. And in 3 other patients, luckily with antiviral therapy, specifically meant for CMV infection, we were able to control the infection with antiviral drugs.
Right, doctor. So you've had these 5 cases. Unfortunately, one has died. Have you heard of such cases in other parts of the country in this second wave?
We did scan the literature, we looked at the media and the publications, and we couldn't find a similar report post-COVID of patient presenting primarily with GI bleeding as a first manifestation after recovery from COVID. See, what we believe is that during COVID, you will have immune suppression and so many viruses. If you remember, we also reported black fungus and white fungus from Gangaram Hospital itself. That was during the time of COVID infection, primarily the second wave. But what was surprising and peculiar and unique in our patients was that these patients had apparently recovered from COVID, resulting in suppression of their immunity. That is the time virus found a good opportunity to get back to its senses and produce alteration in the GI tract. Virus can also affect other parts of the body, including lung, brain, but our patients typically had only GI symptoms. That is the reason they came to us as in gastroenterology. We are not aware of any similar publication from India anywhere.
Right, doctor. In fact, in the second wave, and correct me if I'm wrong, but there have been more cases of gastro-related, impact of the COVID infection than we saw in the first wave, at least.
Yeah, you see, this virus is known to have entry into the body cells through the ACE receptors. Now, ACE receptors are known to be primarily present in the lungs, but they are also known to be existent in the GI tract and also in the hepatobiliary system, which is a part and parcel of the intestinal tract. So whenever you have either the drugs which are given to take care of the viral infection, most of these drugs, including antibiotics, steroids, or immunosuppressants, will have some collateral damage to the intestines, and there is also direct effect of the virus onto the intestine. In fact, in the first published literature from the Western world, 1/3 of the patients with COVID-19 had first presentation with intestinal symptoms in the form of abdominal pain, nausea, vomiting, and bloating. But this type of massive bleeding requiring hospitalization was peculiar to us and possibly resulted because of the suppression of the immune response following severe COVID infection. Moreover, the drugs which are given to treat these infections like tocilizumab, tofacitinib or steroids further cause suppression of the immune system. So you have a double whammy of the virus itself and the treatment given to take care of it.
And if you could tell us, those who have recovered from COVID, what do they need to watch out for so they can, catch it early? Though it does seem just 5 cases so far, so it's possibly not something that is very prevalent.
Yes. We wanted to increase the awareness of this peculiar entity. As I said, the virus is not unknown to us. It is a common part of our body. 80 to 90% of us harbor the virus in a very dormant, latent state. But our impression was that if we are able to increase the awareness of this atypical manifestation, so anybody who has substantial bleeding following recovering from the COVID, especially if it is not settling with the common drugs, one has to think of this unusual infection also.
All right, Dr. Anil Arora, thank you so much for joining us here on the program.
Thank you.
And now a look at the UK. The United Kingdom is witnessing another surge in COVID cases driven by the highly transmissible Delta variant that was first detected in India. The surge had earlier prompted the government to extend the lockdown easing by another 4 weeks. But now England at least seems set for the government to kick off the final step of a 4-step roadmap out of the lockdown. This comes as 24,248 new COVID cases were reported in the UK on Sunday, alongside another 15 deaths. More than 63%, however, of the UK adult population has now received a second vaccine dose. Well, to talk more about England, we're joined by Dr. Veer Pushpa Gupta, physician, National Health Service, UK. Thank you so much, Dr. Veer, for joining us on the program again. And first and foremost, so it does seem that England is headed to lift all restrictions, or most restrictions rather, in a few days.
Yes, thank you for having me on the show once again, Gargi. It does seem like that, yes. And I think the reason for that is that if you look at the numbers that have gone up, 24,000 cases, as you mentioned, daily, that's a 181% rise in the last 2 weeks due to the Delta and the Delta Plus variant that is now the prevalent variant in the United Kingdom. However, if you look at the graph and you compare it to December 17th, which is the last time we had 24,000 cases, you'll see that the hospitalizations and the deaths are very, very low at this point. And I think a lot of that has to do with the vaccination that has happened in the UK. As you said, 60% and more of the population has been vaccinated. And Public Health England just released a study saying that if you have had 2 doses of the Pfizer or the AstraZeneca vaccine, the chances of hospitalization go down by 92%. So at the moment, we're seeing high numbers of cases, but we're seeing mostly cases that do not require hospitalization, and the deaths are steadily increasing very, very slightly, but not at the rate that we saw in December. And I think that officials are taking that into account. Now, we have to wait and see how that number goes up, and if it goes up at all, and whether these vaccines have some sort of resistance to the effect of the Delta virus. And I think that remains to be seen. But at the moment, things look like the vaccines have made an effect.
Right, and 19th July is when, we're expecting that the announcement will be of lifting all restrictions. But what are the concerns that remain, and what about schools? What is the thought there, and what are the indications from the government?
I think schools are the main concern, and I think young kids and young population are the main concern because they have not been vaccinated yet. And the UK just recently opened the vaccine to everyone above 18. And now they're planning to go ahead with vaccinations for the younger population as well, because as we know, the Delta variant affects the young more than it affects the old. And we saw that in India. We're seeing that now in South Africa, who have just gone into a new lockdown for their 3rd wave. So I think we have to be cautious. We have to be careful. I personally do not agree with the fact that all restrictions should be lifted at once. I think that the delay from June 21st to July 19th already caused a 50% decrease in the rise of infection. So social distancing, mask wearing are restrictions that should be in place until we have a complete hold on this virus. However, it remains to be seen if the UK will do that. Economic concerns, travel concerns, There are international sports events going on in the UK at the moment. So there's a lot of things that are weighing on the government's mind, but the NHS is cautious.
Right. In fact, you talked about travel and across the world, across Europe as well, the Delta variant is gaining more ground and more cases are being reported. So that's going to be very interesting, or rather concerning, going forward as to how, to control the movement and where you see spikes and how to, suppress numbers. But as you said, it's vaccinations that is the way out, and UK doing very well, but other parts of Europe aren't doing so well when it comes to vaccinations.
And I think that is the tricky part in opening up travel. If you have a nation that is now vaccinated close to 60 to 70% of the population, and you open up travel, and then you have people coming in from various countries that may or may not have completed their vaccination, although there will be restrictions in place for that. But, the mixing of populations, the entry of new variants, we know that the Delta variant entered the United Kingdom in 4 or 5 days at the time that the UK took to close down flights from the subcontinent. And I think that it just takes a few days nowadays for a variant to cross over to another part of the world. So that is the main concern in opening up travel. And that's why the UK has largely been closed to the rest of the world for the last year or so.
All right. And when you talk about, the last restrictions to be lifted, what exactly are we talking about, if you could explain to us?
Well, the plan is that they're going to restrict all restrictions, which is mask wearing, social distancing, the restrictions on numbers of people within a closed setting, and it'll just go back to life before the pandemic. Now, how much of that is going to happen is still to be known. I think Boris Johnson is going to make an announcement on the 12th of July, and he will be laying down the roadmap for that opening of restrictions. But as you know, the Health Secretary of the United Kingdom has recently been changed, and I think that his ideas might be different to the previous ones. So it remains to be seen how far we go in terms of lifting the restrictions, but it will be interesting to see what happens once those restrictions are raised.
All right, Dr. Gupta, thank you so much for joining us on this issue, and time for us to slip into a short break. On the other side, we'll have Dr. Veer Pushpa Gupta back to answer questions that are asked about vaccines and COVID. Stay with us. Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about the vaccines, about coronavirus, and questions that you often look up online and Google. And we're joined by Dr. Veer Pushpa Gupta from London. Thank you for staying on with us, Doctor. And one of the questions that people still ask, I know it's been many months of the vaccination drive in India and in different parts of the world, but people still want to know, are COVID vaccines effective?
Well, yeah, that is what is on everyone's mind, because that is the first thing you think of when you go and get the vaccines. And I think one has to only look at the graph in the United Kingdom, if you Google the graph on United Kingdom, to see how the deaths versus the hospitalizations have done in the second wave compared to what is happening right now. And I think that would give us a good idea. As I said, if you take one date on that graph, 17th of December, compared to today, which is a date that had equal number of infections, 24,000 infections per day, and you compare it to the deaths and hospitalizations on that day versus today, you will be able to see how vaccines have been effective. And that is the only reason that we are even thinking of opening the country this month, because of the amount of effect that vaccinations have had. And I think that's the only way to prevent a third wave in India, is to vaccinate as many people as possible.
That's right. And people also then, get into discussions about the efficacies of different vaccines. You have the AstraZeneca here, Covishield, you have Covaxin, we have Sputnik, and hopefully we'll have other vaccines soon. What do you think about such, scrutiny of the effectiveness of vaccines? There in the UK, you also have Pfizer as well as AstraZeneca.
Yes, and I think a lot of the data that we have is AstraZeneca and Pfizer. Although we use Moderna, and I think Johnson & Johnson has also been approved here. So the data that about AstraZeneca is the main one that will concern India, because that's the vaccine that is being used in India. We don't know much about Covaxin, but I think Covishield is shown to be quite effective, and it has shown to decrease hospitalizations by 92%. Specifically in the Delta variant. That was the latest data that was released by Public Health England. So that alone should give a lot of confidence to people, and in the public health setting should give a lot of confidence to the people giving the vaccine as well, that this could work to prevent a third wave.
Right, absolutely. And you know, some people wonder, why are you then having these breakthrough infections? Because, we need to explain to people that while vaccines are effective, it's not 100% guarantee against getting an infection, but it will help in preventing hospitalization, which is the example you're giving, isn't it, from the UK?
Yes, and this is what I tell all my patients as well. Getting a vaccine does not protect you from getting the virus. I think the virus you'll be protected by the virus if you do basic hygiene measures and keep your own hygiene well. But if you get the virus, you have less likelihood of getting hospitalized and then being escalated to ICU care. And I think that is the most important thing. I don't think coronavirus is going anywhere. I think it's going to be in our population for the next hundreds of years, and it's going to be spreading just like the flu spread. But just like the flu doesn't cause people to get into the ICU and die as regularly as it was happening with COVID, I think the vaccine should be able to protect us to have a less exaggerated infection.
All right, Dr. Veer, another question that people often ask is, are there side effects of the COVID vaccine?
Well, the most reported side effects of the vaccine are pain at the injection site, fever, and sometimes headache or flu-like symptoms, which resolve usually in about 48 to 72 hours in most people. Now, a very, very few amount of people in the UK and in Europe experienced some very rare blood clots with the AstraZeneca vaccine. They were mostly seen in younger people with already pre-existing concerns of getting blood clots. So the numbers are extremely low. They're even lower than the general risk of the population of getting blood clots in the brain. So I think that is the reason why AstraZeneca was kept a little bit under scrutiny for the last few months. But in terms of protecting against COVID, I think it's still a very, very effective vaccine, Covishield. And the risk of getting a blood clot with COVID is much higher than the risk of getting a blood clot with the Covishield vaccine.
All right. Well, thank you so much, Dr. Veer Pushpa, for speaking to us.
Thank you.